If your blood pressure has been creeping higher and you keep wondering whether the problem is your age, your stress, or your medication, I need you to stay with me because the answer may be sitting in your kitchen right now. And it is probably not the food you think it is. Most people assume the hero is a banana. It's not. In fact, the food at number 1 in this video can deliver several times more potassium than the snack millions of people reach for when they're trying to eat healthy. And that matters because potassium is one of the most overlooked tools for bringing blood pressure down naturally. But there's a mistake almost everyone makes with these foods. And if you make it, you can completely cancel the benefit before the first bite is even finished. Before we begin, please subscribe and stay with me because what you learn today could protect your heart for years. And let me make one thing clear right at the start, because this is important, is when I say these foods can help lower blood pressure instantly, I do not mean they act like an emergency drug. If your blood pressure is dangerously high, or you have chest pain, shortness of breath, severe headache, weakness, or confusion, that is not a kitchen problem. That is an emergency problem. What I mean is this. The moment these foods begin replacing salty, processed, blood pressure-raising meals, your body starts moving in a better direction. Sodium starts losing its grip. Blood vessels begin relaxing. Fluid balance starts shifting. That process begins faster than most people realize. Let me tell you about Walter because his story is the reason I wanted to make this video. Walter was 72, careful, disciplined, the kind of man who took his blood pressure every morning and wrote every number down. And then, out of nowhere, his readings started climbing, not a little. I'm talking 148, 152, 158 on the top number. He was convinced his medication had stopped working. He started getting frightened every time he wrapped the cuff around his arm. But when I looked at his routine, what I found was not a mystery in his medicine cabinet. It was a pattern on his plate. His breakfast had become toast, processed turkey, canned soup leftovers, and crackers later in the afternoon. Very high sodium, very low potassium. His body was getting pushed in one direction all day long, and his blood pressure log was telling the story. Here's the piece almost no one explains simply enough. Potassium and sodium are constantly working against each other inside your body. Sodium tends to pull fluid in and keep pressure up. Potassium helps your body get rid of excess sodium through urine, and it also helps relax the walls of your blood vessels. That means when your diet is too high in sodium and too low in potassium, your blood pressure is fighting uphill all day. But when you start bringing in more potassium-rich whole foods, especially the right ones, the balance changes. Not magically, not overnight in every single case, but the body begins responding immediately to a friendlier environment. And that's why some people see calmer readings within days of changing food patterns, while others need a little longer for the trend to become obvious. Now here's what frustrates me. Most people hear high blood pressure and instantly focus on what to remove. Less salt, less fast food, less processed junk. And yes, that matters, but they stop there. They never ask the second question, which is just as important. What are you putting back in? Because lowering sodium without increasing potassium-rich real food is like trying to empty a bathtub while the faucet is still running at half speed. You've made progress, but not enough to change the whole system. That is why the foods in this video matter so much. And I'm counting down to the most powerful one last, because number 1 is the food people avoid out of fear, even though it may be the exact food their blood pressure has been waiting for. Before we get there, we need to start with number 3. Food number 3 is plain yogurt. Not dessert yogurt, not candy in a cup yogurt, not the kind with cookies crumbled into the lid and enough sugar to make your morning worse. I'm talking about plain yogurt, ideally low-fat or Greek if that works for you. And I know some people are already disappointed because they wanted something more dramatic, but stay with me. Plain yogurt is one of the easiest, most realistic blood pressure supporting foods for seniors because it gives you potassium in a form that is soft, familiar, simple to portion, and very easy to build into a routine. That matters more than people think. The best blood pressure food in the world is useless if you never eat it. Yogurt wins because it slips into breakfast, lunch, or even an evening snack without turning your life upside down. And that makes consistency possible. Let me tell you about Denise. Denise was 69, recently widowed, and her eating habits had changed in a way I see all the time. She wasn't cooking much anymore. Breakfast became packaged cereal one day, toast the next day, sometimes nothing at all, and then by evening she was so hungry she'd reach for salty snack foods. Crackers, deli slices, frozen meals, canned soup. Her blood pressure wasn't in crisis, but it was drifting upward, month after month. When we looked for the easiest place to intervene, breakfast was the opening. She started keeping plain yogurt in the refrigerator and adding berries, a spoon of oats, sometimes a few chopped walnuts. That one shift didn't make her perfect, but it made her mornings less salty, more satisfying, and much more potassium-friendly. Within a couple of weeks, her morning readings began looking less jagged and more stable. Here's why yogurt earns a spot on this list. First, it provides potassium in a very practical serving. Second, it often replaces a breakfast that would have been much worse for blood pressure. That substitution effect is huge, and people miss it all the time. The benefit is not just what yogurt gives you, it's also what it stops you from eating. A sugary pastry and salted convenience breakfast can set the tone for the entire day. Plain yogurt with fruit gives you a calmer launch. It also brings protein, which helps with fullness, so you're less likely to go hunting for high-sodium snacks 2 hours later. And when you add fruit like berries or kiwi, you're quietly building an entire blood pressure-friendly meal instead of chasing one miracle nutrient. That's how real improvement happens. Not through magic foods, but through better combinations repeated often enough to matter. But I need to warn you about the trap. A lot of people hear yogurt and buy the sweetest, most processed version they can find. Then they wonder why they don't feel better. Read the label. If it tastes like dessert, it's probably acting like dessert. And if you are very sensitive to dairy, lactose intolerant, or it simply doesn't agree with you, don't force it. This is not about suffering through healthy food. It's about giving you workable options. If yogurt works for you, great. If not, there are other roads to potassium. But for many older adults, yogurt is an easy win because it is gentle, accessible, and easy to keep on hand. Denise used to think she needed a complicated meal plan. She didn't. She needed one repeatable choice that lowered the temperature of her mornings. And yogurt did exactly that. Now we move to food number 2. And this is where people start to realize they have been underestimating the entire category. Food number 2 is beans. Beans, lentils, and their close cousins are some of the most powerful foods you can use when blood pressure is trying to climb. And this is the point where some people immediately back away because they think beans are boring, heavy, or only belong in giant dinners. But that thinking costs them one of the best tools they have. Beans bring potassium, fiber, and a kind of fullness that protects you from the endless snacking cycle that drives sodium intake higher and higher. And the version I want you to picture is not a salt-loaded restaurant side dish drowning in sauce. Let me introduce you to Robert. Robert was 75, living alone, and he had developed what he called his easy lunch. Every day, almost without thinking, he opened a can. Sometimes soup, sometimes stew, sometimes beans, but the kind packed in thick, salty sauce. He thought he was doing fine because he wasn't eating chips or fast food. But his sodium intake was enormous, and his potassium intake was nowhere near enough to counterbalance it. When we talked through his meals, I didn't tell him to become a gourmet cook. I told him to keep it simple. Low-sodium beans, rinsed if canned. Add olive oil, garlic, herbs, maybe chopped tomato, maybe a little tuna or leftover chicken, maybe toss them over greens. That one change started replacing canned sodium bombs with something that actually supported his blood pressure. And within days, he told me the afternoon swelling in his ankles even felt a little better. Beans matter for several reasons at once. Yes, potassium is a major part of the story, but beans also bring fiber, and fiber helps with fullness, weight control, and steadier eating patterns. That matters because blood pressure is rarely just one nutrient behaving badly. It's a pattern problem, a food rhythm problem. A what do I keep reaching for when I'm tired, stressed, or hungry problem. Beans interrupt that pattern beautifully. They are cheap, they are versatile, They work in soups you make yourself, salads, bowls, wraps, and side dishes. And they're one of the easiest ways to turn a meal from processed to protective. If your lunch usually comes out of a box, a bag, or a drive-through window, beans can be the point where the whole meal starts behaving differently in your body, and your blood pressure notices. But there is a mistake here, and it is big enough to cancel the win. If you choose beans, drowning in sodium, you